Hello, my name is Alyssa Duffy. In this video, we will explore the sagittal plane biomechanics of the ankle joint during level walking. Using inverse kinematics and inverse dynamics data, we will examine joint angles, muscle movements, and their clinical relevance. The gait cycle is divided into stance, when the foot is on the ground, and swing, when the foot is off the ground. Understanding ankle motion and muscle activity during these phases is key to assessing functional gait and detecting impairments. Results. The ankle joint displayed a characteristic sagittal plane movement and motion and pattern across the gait cycle. At heel strike, the ankle was positioned in slight dorsiflexion 5 to 10 degrees, allowing the foot to contact the ground smoothly. During loading response, the ankle moved into plantar flexion 10 to 15 degrees as the foot lowered to full contact. Through mid-stance, gradual dorsiflexion occurred as the tibia advanced over the stationary foot, reaching approximately 10 to 15 degrees dorsiflexion prior to heel rise. This was followed by a rapid transition to plantar flexion 20 degrees during pre-swing, corresponding to the push-off phase. During swing, the ankle returned to a neutral or slightly dorsiflexed position to allow for toe clearance. The ankle movement curve showed an initial small dorsiflexor movement in early stance, reflecting eccentric activation of tibialis anterior controlling foot lowering. This was followed by a large plantar flexion movement, peaking at around 100 nm in late stance. The moment then decreased rapidly during swing, where minimal torque was observed due to limited ground interaction. Interpretation. These findings reflect normal ankle biomechanics during level walking. The early stance dorsiflexor activity acts eccentrically to control the foot's descent following heel contact. As the gait progresses, the plantar flexors, mainly gastrocnemius and soleus, become the primary torque generators, working eccentrically during mid-stance to control tibial advancement and concentrically in late stance to produce the propulsive push-off. The temporal relationship between increasing dorsiflexion and the subsequent plantar flexion moment demonstrates effective muscle coordination and energy transfer. The magnitude and timing of the peak plantar flexor moment are consistent with typical gait patterns in healthy adult and indicate efficient ankle function for propulsion and forward progression. The observed ankle kinematic and kinetic patterns reflect efficient energy transfer and controlled motion throughout the gait cycle. In healthy individuals, the balance between dorsiflexor control in early stance and plantar flexor propulsion in late stance contributes significantly to gait efficiency and overall lower limb stability. Clinically, deviations from this pattern, such as reduced peak plantar flexor moment or limited dorsiflexion range, can indicate weakness or dysfunction in the gastrocnemius soleus complex or altered motor control following injury or neurological impairment. Such changes often lead to compensatory adjustments at the hip and lumbar spine, including increased hip flexor or extensor activity and altered trunk posture to maintain forward progression. Understanding these interactions is essential in both rehabilitation and performance settings, as impaired ankle functions can propagate proximally, influencing lumbar loading, pelvic stability, and gait symmetry. Therefore, assessment and targeted strengthening of the ankle, plantar flexors, and dorsiflexors are crucial for restoring optimal gait mechanics and preventing secondary overuse in the hip and lower back. Thank you for listening.